Hello, everyone, and welcome. My name is Corey Thornton. I am the Managing Editor for Market Intelligence at Open Minds. Today, as part of our weekly executive web forum series, Open Minds Senior Associate Ken Carr will discuss improving collections through best practice revenue cycle management. Mr. Carr brings over 30 years of finance, technology, data analysis, and reporting experience to today's webinar. And for some housekeeping reminders, your audio is muted today, but we would also like to hear your questions submitted via the comment box on the right side of your screen. You can send those throughout the briefing and Mr. Carr will answer them. The slides and recording for today's briefing will be available on the Open Minds website starting tomorrow. And with that, Ken Carr.
Thank you very much, Corey. And welcome to everyone joining us today to look at this topic of improving our collections through some best practice revenue cycle management tactics. And so today we want to talk a little bit about the context of improving our revenue cycle management. I don't think there's a more important time than now to really be digging into what we're doing with revenue cycle. I want to talk a little bit about what it is, and then talk through some best practices that we think are helpful for organizations. Want to spend some time also on analytics, because our ability to do a really good revenue cycle management is linked to our ability to get good data and analyze that data. So we're going to take a look at some examples of some analytics. Then I want to close out our session by looking at the movement from fee-for-service to value and the impact that that has on revenue cycle management. So with that, let's talk a little bit about the context. We know right now that we're yet in the midst of the pandemic. And even as we look into the future, into the first, second, third quarters of next year, we'll continue to struggle with the impact of the changes that have happened in our market and in our funding. And that, of course, will continue to have impact on our cash. So when we think about the need for a revenue cycle management in our current market setting, three things come to mind. One is really maximizing our cash for sustainability and growth. And when I think about a number of organizations, and we've done a number of surveys, a number of organizations have really had thin cash coming into the pandemic. Some organizations with 20 to 30 days of cash on hand, which is very tight. Organizations that are pushing 45 to 60 days or more of cash were much better prepared moving into the pandemic. One of the things we've also seen with some organizations is they've been able to manage cash during the crisis because of government assistance, but that assistance is going away. And so our ability to have really good revenue cycle management now moving into the future is really key. We do anticipate that a lot of the relief that organizations are able to tap into now will be ending. And so, that's one aspect. The other aspect is really improving our performance overall, moving from a deficit level to a place of having some net margin. And even considering the fact that not only were we focused on increasing our revenue, increasing our cash, but good revenue cycle management provides better services overall. It looks at the area of access, it looks at the area of consumer satisfaction from first contact all the way through paying for a service. And it has the opportunity to increase value to consumers by providing more transparency up front in terms of what's owed and what a consumer's responsibility is going to be towards their services. And then the other thing is just preparing for the value-based market. We anticipate that there will be continued movement to value over the next few years. And even as there's pressure on governments to cut back, as there will be more individuals moving on to the Medicaid rolls, there will be more uninsured individuals. The MCOs and the state governments that are contracting with MCOs will really be looking at opportunities to make sure that there are good quality services at the very lowest price. And so value is going to really move along. And our ability to do good revenue cycle management now prepares us for the changes and how we'll do it moving into a value-based market model. So there are opportunities, and now is the time to really look at what you're doing related to revenue cycle management. There's just a few statistics related to revenue cycle management. Most organizations, and this is based on surveys across the country, healthcare organizations, have identified the cost to collect. So all that you invest in having staff who are doing billing, who are doing the various aspects of verifying authorizations and insurance, all of those costs range anywhere from 2 to 4% of your net billings. And of course, you want to be on the low side of that. And so as we walk through some best practices today, keep in mind that your organization really needs to have an idea of how much does it cost to collect on the billings you send out the door, and where do you align in terms of other organizations? How do you line up with the benchmark? One of the survey findings as well out there is that organizations with the highest cost to collect spend more on salary and benefits than high performers, which has the lesson for us that the more we use technology, the less it will cost to collect, and our collection will be higher. And so your ability to work your revenue cycle management around technology is very important. We think in terms of the cost of collecting from insurers, MCOs, and commercial insurers, but it's also important to know that 68% of consumers fail to fully pay off their medical bill, and that number is actually expected to go up with the effects of the pandemic. In 2020, that number is expected to be 95%. So your ability to not just work well with payers, but also to be engaging consumers from that first point of contact, so they know how much they're going to need to pay, that they know their responsibility, that you're connecting with them around that becomes extremely important. 92% of consumers want to know their payment responsibility prior to the first visit. This is the age of consumerism. And so whenever I incur any service, I buy any product, I want to make sure I know upfront what it's going to cost me. I want to make sure that I'm getting a good value compared to other alternatives as well. And so this really fits with the concept of this new consumerism, this Amazon approach to I want something fast, so good access. I want it at an affordable cost. And I want to make sure that I'm getting the good quality that I would expect. It costs 4 times more to collect from a consumer than it does from an insurance company. And 80% of consumers say they would prefer to pay for their care online. So how are you using that technology, that consumer portal, to enable folks to be able to not just access services or schedule services, but also pay online? So let's just start at the very beginning here and look at what is revenue cycle management. And it's important to acknowledge that revenue cycle management isn't something that just the billing staff do. It's all of the administrative, all of the clinical functions that contribute to our ability to capture the right data, to manage that data, to meet the requirements of payers, so that when we send out a bill, we are able to collect the revenue and the cash related to that bill. The life cycle of a client account, it's from the creation, from the time you bring a new consumer into your organization, you enter them into the EHR, you're collecting the data that you need to successfully collect from the MCO, from the payer, and from that individual at the very end of your service provision. And we also think of it in terms of the account cycle. So it's the cycle of activities that's necessary to ensure that all encounters are first billable. So we're not missing any opportunity to recognize revenue. We're meeting all of our compliance or regulatory requirements, and that we're maximizing both the revenue we're recognizing and the cash that we're collecting. So we think in terms of a cycle, and the typical facility-based notion of a revenue cycle kind of starts with patient access. The point that a patient reaches out and as either a new patient or returning patient or consumer, and they make that initial access. So they reach out to the organization, we register them, we schedule them. Often we're using a call center for that, so that we have very structured processes of gathering the right information. And best practice would be that your EHR is set up to very conveniently capture all of the information, and you can't even close down that record until you've gotten all the critical information that you're going to need. So, centralizing that process of when I as a consumer call in, how I'm going to register, what information is captured, and how that scheduling then happens. Registration needs to identify who is your payer, so we can know what's your contribution going to be, what services are covered at what level. Let's schedule you with the right clinician who is credentialed with your organization. So this is such a key step, this very first step in the process. And then of course there's the intake process. It's the doing of the assessments. It's ensuring that we meet all the requirements that will be needed related to an authorization for services moving forward. And so these are our key administrative functions of just bringing an individual into the organization. And then of course we have the clinical functions, and clinicians play a role in our ability to collect every potential dollar. Service delivery, documentation, we'll talk a bit about best practices around that. Our ability to capture the charges, do the right coding. Sometimes that's done by clinicians, and if you have a very small set of services that you're billing for, sometimes the clinician is able to capture that, and you've optimized your EHR to collect what's necessary for those services to move right into a billing review and claim processing system. However, sometimes when you've got a lot of services that you're providing, a lot of complexity, you may spend some additional resource in looking at charge capture and looking at coding. Are we coding at the right level? Maybe assisting the clinician to be coding in a way that maximizes both the compliance with medical necessity, but your ability to arrive at the right level of revenue for the service that was provided. And then, of course, utilization review. Utilization review, making sure that all of your documentation is clear. When a payer calls, you're able to provide the documentation on why medical necessity was indeed met in order for that claim to be billed. So these clinical functions become very important. And then we move over to the billing, the revenue cycle department. And it's the claims submission and tracking, and before those claims even go out the door, there is a process to scrub those claims to ensure that all the requirements have been made. You're going to submit those claims. You're going to have a denial management and appeal process for anything that's denied, really digging down and understanding that. Remittance management, so your ability to take the remittance documents when a claim comes in, to analyze that remittance and very efficiently apply that back to the various consumer accounts. And of course, then really the patient payment resolution issues. So what did the payer, the patient owe, the consumer owe after the healthcare company paid, the commercial payer paid? So this is the full process then, and along the way, you're going to have specialists, you're going to have a good process in order to move that along. When I think about revenue cycle management, there are three key goals from my perspective. One is maximizing revenue, and a lot of organizations really struggle with, are we recognizing enough revenue? Maybe we're incurring a deficit. And one of the first things I do when I do a financial analysis of an organization is to look at that bottom line, to look at revenue, to look at the percentage of revenue that's actually being recognized and not written off. And so your ability to maximize revenue by having good processes that reduce bad debt write-offs is goal number one. You want to maximize that revenue. It goes right to your bottom line. Your ability sometimes of having either a deficit on operations or moving into the surplus area might be related to how much bad debt you're writing off. So revenue maximization is goal number one. Goal number two is really to increase cash. So collecting every dollar possible for every claim that goes out the door. It's going to increase your working capital, which is going to position your organization in terms of any unexpected drains on cash, any unexpected changes in the economy, your ability to have working capital to expand, to invest in technology. So overall, increasing those number of days of cash. Once again, an organization should be well over 45 days and be aiming towards 60 to 90 days of cash on hand. So increasing cash is goal number two. Goal number three then is increasing cash flow, or the speed of cash flowing into the organization. And so you may collect the cash eventually, but if you can speed up that cash flow, how long does it take from the time that a person is seen to drop a claim and send that to the insurer and then receive payment? You want to be shortening that time period, because the more cash, the faster cash speeds in the organization, the more cash you're going to have available for other needs. So maximizing revenue, increasing cash, and then increasing the speed of cash. And those are the three things you should be looking at when it comes to metrics for driving your revenue cycle management. When I think about the foundations of revenue cycle management, there are four key building blocks of a solid system. And I would say that the foundational building block ends up being workflows. So have you created good processes? And when we looked at that revenue cycle and all of the steps that are involved in ensuring from the point someone comes into the organization to be served until we get paid by them, all of those steps, you need really solid workflows. So each step in the process, you've identified clearly the roles, you've identified clearly the tasks that need to be done, and you've clearly identified how the information is passed off to the next step. Workflows are really key. They have to be logical, they have to be clear, they have to be available to staff, and they have to be continually improved. And I personally opt for workflows that are very easy to see. So diagrams, those that you look at it, you can easily see the process. And secondly, that can be easily updated. So investing in whatever technology you need, so you can be updating those workflows as you find a better way, a more efficient way of doing it. Right along with workflows, just a step beyond that is the area of technology. And not only do you need those good workflows, but you need to figure out how can you utilize technology to make those workflows as efficient as possible. In this area that I mentioned earlier, just looking at some of the statistics, the most effective organizations in reducing the cost of revenue cycle management are those that have implemented technology. And so taking those workflows and coordinating with technology, and this is a process that kind of works together. You don't want your workflows to drive how you set up your technology, because sometimes technology developers have really come up with some very good tasks, processes, functions to support your revenue cycle. So you want to work the workflows and the technology together in order to create an efficient system. On top of that, I do think you need talent, and having individuals who want to have growing experience in the area of revenue cycle overall, who have growing experience in each of the payers and the payer requirements, talent related to managing credentialing, which can be a significant part of the revenue cycle process, having clear expectations for those talent as well. And then the specialization, and I think as an organization begins to have some size and economy of scale in terms of their revenue cycle department, your ability to really specialize in each of the key areas will enhance your efficiency overall. And then oversight becomes important. So having clear oversight, who's responsible for what, and within oversight, I would include this whole concept of reporting and analysis, doing analytics, understanding where the issues are and how to better improve the process. So those to me are the 4 key building blocks of a solid revenue cycle management system. So let's talk a little bit about some best practice in revenue cycle management as well. You know, we talk about those 4 phases of revenue cycle management. This is a little different than what we looked at earlier, because I here am dividing out the billing and collections piece with a monitoring and process improvement step as well. But overall, we think of 4 phases of revenue cycle management. The first being referral and intake, where we're really verifying who's going to pay for this service and how much is each payer going to pay. We're looking at what authorizations are we going to need to provide this service and have the payer pay for them. We then move to service delivery. Do we have we met all the credentialing requirements of the payer for the clinician to provide the service? Are we documenting according to medical necessity and documenting a level that will meet utilization review requirements by that payer? We then look at billing and collection. So, you know, we're scrubbing those claims. We have processes in place so a claim is not going out the door until it meets all the internal requirements set up in the EHR. And then someone is looking to confirm that and bundling those up and sending them out by payer. Looking at denials management, how are you assessing and creating better process by looking at those denials? And then the whole payment receipt and posting process, how can you make that as efficient as possible? And then at last, really monitoring process improvement. So what analytics should you be using, and how are you going to improve that process continually? I want to just dig into a few of these key areas as we move forward here today. The first is with eligibility. Eligibility is really key, and once again, the most efficient systems that I've seen set up really have a centralized process, a call center even, where individuals needing services are calling in, and the first thing the person on the manning the call center is going to do is certainly get the demographic information, but ask for their insurance, because they want to right there on the phone confirm eligibility. And so getting that name of that insurer, getting that member number, and right there inputting it so that while the consumer is on the phone, you have now confirmed eligibility. You can pull up benefits. It becomes that very first step, because you don't want to bring someone in, schedule them for an appointment, and then find out that their insurance had lapsed, or that they're going to have a significant co-payment for their insurance that they did not expect before they came in. So to do that, you really need staff who have expertise in all of the insurance plans. So for organizations working with maybe 3 or 4 MCOs in the area, that can become pretty standardized, but a lot of mental health clinics, for instance, accept a lot of different commercial insurance. And so your ability to begin to understand that becomes key. And one of the ways you do that is having staff begin to specialize in understanding those plans and those coverage options. So if the call center person really isn't able to right away get the information they need, can they call in that insurance expert who's a part of the billing department, the eligibility department, and get the information that's needed? So with that, then that becomes that first key step. To the extent you can really configure your technology to confirm the eligibility immediately, so you have that direct link, you are better positioned. And to the extent you can, even with your technology, pull up the benefits for a particular payer and be able to reference that while on the phone with the consumer, once again, that would be a best practice for being able to make sure that there aren't issues later down the road. Clinical authorizations become very important. You know, as a part of that first call, understanding what authorization might be needed so that that can become a part of the first visit that a consumer makes. So looking at authorizations, what initial assessment might be needed, are there diagnostic codes that are going to be required, who would be a credentialed payer that would need to provide that service. All of that becomes very important. So having that in your technology is that key step. Authorizations also need to be tracked. And so if you identify that an individual is authorized for 20 sessions of seeing a particular clinician, you want to be able to set that up so that it is automatically tracked within the EHR, within your technology. And not only that, but if a reauthorization is going to be needed, that there is an alert prior to the expiration of the current authorizations, giving you adequate time to pursue another authorization if it's needed and allowed. So once again, we need competently trained staff, specialists in this area. And it really is important. Some organizations, some payers refuse to reimburse even at a later time if you've not adequately moved through the authorization process initially, and they will deny that based upon an administrative denial. So your ability to capture authorizations, know what steps are needed before you provide that service, once again, reduces potential write-offs of bad debt and increases your ability to collect either from the payer or from the consumer. Credentialing is one of the biggest challenges that I've seen a number of organizations struggle with, especially if you have a lot of different insurance companies. So your ability to, what's your process to have ability to verify, document credentials of clinicians when they're hired, to capture that in some form of software, to know when recredentialing is going to need to happen, ensuring that clinicians are credentialed with all of the different networks so that they have as much elasticity within the organization to serve a large number of consumers, irrespective of what insurance might be needed. Assigning the credentials to a specific person, integrating the process, either with an HRIS system with your EHR, or even with a specialized credentialing system that links into your EHR, becomes really important. I've seen a number of organizations utilize spreadsheets, and a spreadsheet is always an effective process, but the larger the organization, the more complexity, the more a specialized approach to credentialing and a specialized technology is helpful. So this becomes an important part, and it has to link into the information that those initial call center staff have for assigning consumers to clinicians. Documentation, just a few things about documentation, and we know that the best documentation is always collaborative, and a lot of clinicians have gotten to a point where they're able to do very collaborative documentation electronically while connecting with consumers. And it has to be concurrent as well. The best documentation is gathered at the time of the interaction. That's best practice, capturing it right there, making sure it's clear, but also it's more efficient from a time standpoint, because if someone at the end of the day has to look at written notes and enter them into the technology, it creates this efficiency, this inefficiency, this extra time. So, and then you need to make sure all the required documentation is completed prior to the service delivery. If the diagnostic assessment is needed, a goal plan needs to be in place or updated, other assessments, making sure and configuring your technology so that all of those requirements are linked together is very important, so that you're not moving forward if a crucial document has not been already completed. Charge capture should be standardized, ideally configured behind the scenes with the EHR. And what a number of organizations have done related to charge capture is this next step of really employing a professional coder, someone who really understands the different codes, what differentiates them, the requirements for using one code or another code, to take the documentation of the clinician, to look at that, and to ensure that the right code, the most appropriate code for the services delivered, is then utilized. Investment in a good coder can really help with the ability to maximize revenue. And when we think about the ability to maximize revenue, this is one key strategy: employing a coder to maximize the amount of revenue for the service provider. Claim submission must be complete, must be accurate, must be timely. And so, the claims staff are continually looking at the processes. The claims are kind of accumulating within the EHR. And if there's anything that has not lined up in terms of the logic that needs to occur, then they're following up on it. So if there's a missing authorization, if there is a missing code, anything that might be missing certainly has to be addressed there. Utilizing billing checklists becomes a part of that, and integrating those checklists within the EHR is very helpful. And then scrubbing the claims, making sure that before a claim goes out the door, that you're checking for the required documents, the dates, the workflows, everything is tying out. And then the speed of sending things out the door. So as soon as feasible, if you can be sending things out the day after a service is provided, that's great. If it's once a week, that's better than once every 2 weeks. So once again, if you know a claim is in good shape, that is a clean claim, be dropping those claims as soon as possible, just to speed up cash, that goal of speeding cash in the door. So billing follow-up, what's a process there? Certainly determining what billing denial has come back. So when you're getting your electronic remittance back, it's going to have denial codes. You can link that within your EHR, then begin to dig down and determine, where in the revenue cycle, what's the next step that you need to take in order to address that particular denial. If it's a payer issue, you begin the process of working with the denials and identifying, okay, why is the payer denying all of these claims for this particular code? So once again, you begin to set up a logical process for follow-up. Looking at information gathered at the verification process, did we verify the information properly? Did we get the right authorizations? Is this an authorization issue? If it is, then we need to go back to our workflow and determine what do we need to change to make sure we have the proper authorizations. Confirming the credentials are up to date. Once again, that can be a big challenge. And then the quality of documentation overall. So is there a particular clinician who just isn't getting the documentation as crisp and clean and checking all the boxes that they need to check in order to send that claim out? So what's the quality of the documentation? These are all approaches for following up on potential denials. Cash receipt and posting, doing it timely certainly is important. Comparing the amounts that are received to what was actually billed on a claim-by-claim basis. And then, if not everything was paid, utilizing those adjustment codes to do some analysis. So what are some key strategies for improving admissions processes in particular? Since we know that admissions is that first step in revenue cycle. One is centralizing the accountability for the accuracy, completeness of the demographic information. So at the point that someone is accepting that information, are they verifying the benefits? Are they ensuring that there's a process set up to get all of the authorizations? Are they having access to clinician credentials and checking those? And are they looking at that coordination of benefits? So that training with your key staff who are part of that call center becomes very important. Establishing the required data fields for client registration, performing QA on the data entry, so going back and confirming, are we always collecting all the information? And do we have required fields? So I can't move beyond this record until I have all of that information completed. Using your EHR's edit capacities regarding payer benefits rules to the maximum extent possible. So most EHRs are really looking at having really good systems for maximizing the process, and then establishing a very tight control, security controls. Which people on your staff can actually be changing records? Who has the responsibility to change particular rules for how claims are processed for a particular payer? So really tightening down those controls so that changes don't happen. All of a sudden claims are getting denied and you don't realize that someone had gone on in just to clean up a particular process and ended up creating a number of cash flow issues. Key questions for verifying commercial insurance. Here are a number of key questions I think are very important. Is the policy active? What's the effective date? So as you're taking in the information, the call center person is able to confirm all of this. Is there a waiting period? What is it if there's there? What are those benefits? Are there pre-existing conditions? Is there a cap on mental health coverage, and has that cap been met this year? All of these things become very important. Even if they're not covered on that very first call, they should go to someone in the organization, someone in the revenue cycle department who can be confirming this information and checking up if there are any issues. Service authorization questions. Do you need services to be pre-authorized? How is that done? Who needs to do that? Where is that pre-authorization sent to? And then the credentialing issues, of course, become very important as well. Do clinicians need a specific license or provider number? Can you get authorization for out-of-network providers to render services? So that credentialing issue becomes really key. I want to spend some time talking about analytics for improving the process. I have a quote here from Brad Arthur, revenue cycle specialist, and I like this quote. I saw this quote, and I think it just captures where our focus needs to be in terms of doing really good revenue cycle management. And it says you have to have access to good data and analytics. Review data that supports your key performance indicators every single day of the year. There should never be surprises to your financial leaders in an effectively run office. So you really need to set up those analytics and be using those to understand when issues are developing, what those issues are, and how you're going to solve those issues before they become a major cash flow problem. So when you're looking at those potential analytics, you're looking at workflow, process issues, you're looking at maybe specific staff or clinician, the documentation they're doing, how they are moving through their role, or you're looking at payer, policy, or process issues. One of the important analytics metrics that I think every organization should be looking at is the net collection ratio. And what it does is it assesses the success of collecting billed claims. And so you really look at your total receipts minus any refunds. You're looking at your total charges minus any contractual adjustments, and what you're coming up with is how much, what's the percentage of ratio, what's the percentage or ratio of claims that I am collecting. Your ability to take that data and to trend it so that as you're looking at your trend, you see things begin to go down, you can jump on that right away. It's kind of a gross figure. It's taking all the data so you can begin to identify, oh, we need to dig down, we need to do more specific analytics. And once again, it's important, especially if you're using it against a benchmark. A lot of organizations will shoot for 95 to 98%. I think if you can be at 98% net collection ratio, you're positioned well in terms of both maximizing your revenue and your cash in particular, because this is focused on cash collections. Another important metric ends up being the days in accounts receivable. You're looking at the average number of days cash is tied up from the point of sending out a claim to the point of receiving cash. So remember, you might have provided a service a week previous, and then you have your days in accounts receivable. So your number of days from the time the service actually provided might even be more than this. It's easy to compute. You can use trend analysis with it. Once again, it's kind of this gross figure, so it doesn't allow analysis by a process step or clinician or payer, but you can begin to dig down into the data if you see issues developing. Once again, the industry benchmark ends up being anywhere from 30 to 60 days. The average in our industry is around 42 days. You can keep it down in that 30 to 40-day range, you're doing quite well in terms of your ability to manage the number of days cash is sitting in accounts receivable. I think trend graphs are very important. This is an example of a trend graph, data that was actually pulled together for an organization. And the nice thing about a trend graph is you can easily take a picture and understand, are things overall steady? Are we moving in the wrong direction? Or are we moving in the right direction? I've used graphs like this with the leadership team so that the CEO and other leadership staff are aware of whether we're beginning to have issues in revenue cycle. I've even shared it with board members, because the more a board member understands how do we get our cash and how effective are we at getting our cash, the better we are positioned for them to understand our business model. Aged accounts receivable, once again, you're dropping the AR into buckets. What's current, what's 30 to 60 days, 60 to 90 days, 90 to 120 days. Every organization does this. Every EHR is set up to drop the receivables into these categories. But I think it's really important that we're always aware of what are the benchmarks. One key benchmark that I think is important is that as you're looking at that over 90 days, you should never have more than 20% of your AR in that area. And so if you're beginning to really build more than 20% of your AR in over 90 days, you have an issue, you need to dig down and look at what payer might this be related to. Are there other system issues that might be driving this? So once again, a nice circle graph can be helpful for leadership staff to be monitoring where are we at overall, how current are our receivables, how much do we have in 90 days. For this organization, it was 7%. That's really pretty good. There weren't any major issues going on there. But the other perspective is this is nice for the current, but what do things look like over time? And so for this organization, trending the information about aging was you were able to see that overall, over the 12-month period of time, receivables were growing and they were getting older. And so you can see that issues were beginning to develop within this organization. So what about denials analysis? How do you approach that? Use adjustment codes to really look at those denials. You want to do your data analysis. To the extent you can use technology for that, you're better positioned. And as you begin to pull the data, digging down into the detail will help you better understand what the root causes are. Here's an example of pulling some adjustment codes from an EHR. So categorizing the denial codes and then pulling that data for a particular period of time. Here, missing authorization was a key issue. Incomplete claim information was an issue to be looked at. This organization, fortunately, was not filing past the expiration date, but they were submitting claims for services that weren't covered, or the credentialing issues are beginning to grow as well. So taking those adjustment codes, looking by type, and then digging down to understand what services are these missing authorizations about? Are there particular clinicians that are failing to do the authorizations? Is that a process issue for us? So this kind of denial analysis can help. So with missing authorizations in particular, digging down and understand, oh, payer one. Now, has payer one's requirements changed? Or why are we not missing? Why are we missing that? Do they have a shorter time frame? What's going on with that? So digging down, we understand missing authorization is an issue. Now we can see with payer one, it's a major issue. Missing authorizations by clinician. We look at our clinicians, and there's a clinician number 3. We have an issue here that they're providing services without making sure that the initial authorization, the assessment, some of the documentation was not in place in order to proceed with providing the services. So monitoring and process improvement really is about having structured process documentation, clarity of both the tasks and the roles. And when you build a workflow, you're looking at those two things. What tasks need to be done, who's going to do them, and how are those tasks then going to be passed on to the next step. The goal of process documentation is to make sure that you're integrating best practices, that people are aware of those best practices, and you're continually refining them. So don't get so tied to a particular process or a document that you can't be revising it on an ongoing basis. And of course, version control becomes very important, pulling back the old versions of the documents and getting the new ones out, so staff are operating course according to the most current and the best practice. Narrative documentation, some people like PlayScript. I like visual maps. I actually like investing in software that facilitates the ability to bring a work group together, document a process, publish that process, and walk out the door with everyone having the new process in hand or access through their laptop. And then the last piece is systematic change and improvement, doing your root cause analysis, implementing some plan, do, study, act, so you're continually enhancing the process. Maybe look at lean processes. How can we do this more efficiently, more effectively? Are there steps that we can reduce that just aren't needed? And then you're able to implement Six Sigma once again, your ability to deliver efficiency. And then I want to talk about revenue cycle management under value-based contracting, because if you're doing revenue cycle well under fee for service, you should have a lot of the pieces in place. Good workflow process, good technology that can be implemented, staff with expertise who communicate well and work in teams. And you have all of those building blocks to move then into value-based contracting. So what are the key competencies for revenue cycle management in a value-based environment? One is really building on your technology, because instead of billing fee-for-service claims, which is all volume-based, and you're documenting and you're summarizing and you're sending them out, now you're needing technology to understand who are the most complex consumers that require the most services. So utilizing your software to focus on those high complex consumers, treating them efficiently, and in a way that you're not consuming more resources than the value-based payment that you're getting. If you're getting a bundle rate on a monthly basis, you're entering into a capitated type of agreement for instance, all behavioral health services in a particular county or a couple of counties, then do you have the data that you need? Because your revenue is going to be set. Now you're utilizing technology to manage how services are delivered and what your costs are going to be. So managing the contractual outcomes, whether those are pay for performance, the outcomes related to a specific bundle rate. Encounter reporting becomes very important because now you're getting all those encounters, you're not turning around and billing those. Now you're utilizing them to drive more efficient services, to recognize what consumers are most complex, and to meet the requirements and be able to demonstrate that you provided the services for which you are now billing in an alternate payment method. So revenue cycle management effectiveness really becomes important. The tasks may be the same, but the system, the process, the tasks may be different, but the process remains the same. So technology, what's important there, implementing a technology platform that supports all aspects of revenue cycle management, robust ad hoc reporting capabilities, so your ability to track service utilization, to recognize, reconcile what services were provided with what revenue you project to have, your ability to report those analytical aspects, service and revenue by staff member, by client, by payer, by contract, by program, your ability to collect, report, and analyze the specific metrics that you have to meet in order to be paid. And then this functionality overall to access data sources, use business intelligence, and really drive better services. So technology becomes really very important to the process. Managing contractual outcomes, your ability to understand, track, and manage those outcomes. So what workflows do you have in place? If you need to drive certain outcomes in order to bill for them at the end of the month, if you have a pay for performance contract and you're going to get paid 6 months down the road if you meet certain requirements, how are you tracking those now? That becomes a part of revenue cycle management because you can't bill for them unless all the pieces are in place to ensure that you maximized those services along the way. Your ability to bill for different types of reimbursement methods, and then your understanding of financial risk, because when you move into value, your ability to manage the risk of providing the service and being paid in an alternate method becomes very important. Ability to capture, analyze, and report granular utilization data to payers and the internal team. So once again, taking that data, understanding what was provided, even though you're not billing for those specific encounters, and using that data to better manage service utilization overall. And then finally, just really looking at aligning operational and financial processes to maximize cash flow. One of the challenges in value-based reimbursement is sometimes we don't get reimbursed until a later process occurs, so a later time. And so your ability to be managing cash well, if you're in fee for service and you're moving into value, the ability to have good cash on hand to hold the organization over for some slower reimbursements through value becomes really important to overall cash sustainability. So with that, I think, Corey, I'm going to invite you back and see if we have any questions for our remaining time.
Thank you much, Ken. Yeah, we have a couple minutes. Let's start with I don't want to call it an easy question, but some more generalized question. Who should be involved when creating a revenue cycle management task force?
Who should be involved? Well, and I think that that is an important question. So when we think about how integrated revenue cycle is throughout the organization, I think we have to kind of take a step back and figure out who are we going to include? Now, it's going to depend upon your organizational structure. You have a kind of a practice manager that oversees all of those front office functions. You certainly want that practice manager to be there. If you probably want to bring in someone definitely from finance or from the area of revenue cycle management, it's going to be on that team. I would bring in someone from compliance and quality to give that particular aspect, because utilization management becomes an important aspect of it. And of course, technology. So, really looking at how you're going to ensure you have the right technology, how you're going to bring that billing and revenue cycle perspective in, how you're going to ensure compliance and quality, who from the clinical side will you bring in, and then looking at those front office tasks. Who oversees those front office tasks of registration, verification?
Yeah, speaking of the technology, we have a question. Our EHR isn't set up to process claims well, and our organization has many workarounds to make sure that we don't have denials. What would you recommend for that organization?
I would recommend taking a step back. And that sometimes happens when we've implemented EHRs and then our processes have changed, or we have a different payer, or payer processes have changed. I think when you look at the cost of collecting that we started with at the very beginning of the presentation, it is well worth the time to step back and to do some process improvement, some efficiency redesign and re-engineering. So I would take a step back. I'd look at, what are we doing now? And for each step of the process, how could we do it more effectively? And with that, integrate the technology. Now, I've had good success as well at involving the technology vendor. And so if I know what I need to accomplish moving forward, to bring in that technology vendor to help make sure that we've optimized the system, even if we have to pay for that service, we'll be able to recoup that cost in the future in terms of efficiency overall and increased cash and revenue.
So in terms of improving efficiency, a lot of organizations are being forced to move from fee-for-service to value-based contracts. Does that make this process harder, easier, or does it necessarily make them adapt in a more successful way?
Yeah, I'm not sure if it's harder or easier. I think if you invest upfront in creating a really good revenue cycle management, and by that, you know how to do workflow really well and to adapt workflows as you need to. You have a work group that can come together. You're able to put together that workflow diagram and get that published, and staff are always working from the workflows. That's one key thing. You've optimized your technology. And third, you're really investing in training with staff. If you have those things in place, moving from fee for service into value should flow a lot easier. Once again, those are the building blocks of how we do revenue cycle management well. And so if you're doing it, you set those building blocks, that foundation up well under fee for service, you really should be able to make that transition. So now you have your first value-based contract, and it's pay for performance. You're getting paid a certain amount, but you hit certain targets, you're going to get this additional cash at a later time. You're really optimized to be able to drive the information to clinical staff to have the outcomes to collect on that performance.
Thanks, Ken. We really have about 1 minute left. Are there any final parting words of wisdom that you would like to share with our viewers?
Well, I just think revenue cycle management is just so key for the organization, and investing in doing it well will yield return. I've seen so many organizations that, whether they're small, whether they've gotten large, whether they've merged with other organizations, they always come back to this key issue, because it is the main function of how we bring cash in the door. And it is the main function of how we recognize the maximum amount of revenue for the services we provide. So one, I would invest in the best talent. I'd make sure that I optimize my technology and that I have this ongoing process of documenting workflow that can be modified and improved as needed along the way.
All right, thank you, Ken. And I want to thank everybody for joining us today. I want to remind you all that the slides and recording for this presentation will be available starting tomorrow, and that we will be back next Thursday for the Executive Web Forum, Thinking on Your Feet Now While Planning for the Future, the Monarch case study featuring Monarch CEO and President, Dr. Peggy Terhune. That starts at 1 p.m. Eastern. You can sign up at www.openminds.com. It's listed under webinars in the events tab. Thanks again, Ken.
Thank you, Corey.